Normally I have a little bit more discretion than this, but today I wanted to talk to you about the difference between your core and your abs. A lot of people, they tell me, I've been doing crunches and all these different ab exercises all day long and I'm not getting the definition and the results that I want. And the main reason behind that, especially with ab exercises, is you can go through the motions of the exercise, but if you're not consciously targeting the muscles that you want to work, you're not going to get the definition that you're looking for. So with abs especially, well, I guess I should say core because that's really what I'm going to tell you about, is with your core, the way that your body is at your very deepest level, you have your spine and then you have your internal organs around it. And just on the outside of that, keeping everything in there and keeping everything nice and safe is your transverse abdominis, and those run around this way. They wrap completely around your internal organs in your spine. We call those TVA for short. And then on top of it is where you have your rectus abdominis, which are your six-pack muscles, and then you have your obliques, which run sideways this way, and then you've got some in the back that run sideways that way. So you've got all different kinds of muscles that are working in there. And a lot of people only focus on the most superficial ones, but if you don't work your core muscles, the really, really deep muscles, you're setting yourself up for injury, and not only that, you're not going to get the results that you're looking for. So how you engage your core, which you should be engaging in absolutely everything that you do, not even not only ab exercises, but pressing anything arm, anything up overhead. You want to keep your core nice and tight because that's what's going to protect your back, it's going to protect your spine, and it's going to keep you from injury. So how you engage your core, how you keep it activated, is first you want to engage your Kegel. And that Kegel is, I'm not going to be able to show you because it's so deep inside, but that's the muscle that you contract when you want to stop peeing. So guys and girls are actually supposed to practice this because it helps men with their prostate, and then it helps women during pregnancy with incontinence. So next time you go to the bathroom, try and stop a few times midstream, and that's your Kegel muscle in case you can't figure out what it is. So first you think Kegel, and then next is TVA, which are those transverse abdominis that wrap around your internal organs. And the only way that you're going to do that is you're going to squeeze everything nice and tight, and then you're going to tuck your hips underneath. So that's how you know that your core is engaged. So from the side, I'm doing Kegel first, and then I'm doing transverse abdominis. So my hips tucked underneath. That's how you know that your core is engaged. You should never, ever, ever have an arch in your back. That's how you know that your core is not engaged. So everything's tucked underneath. And so you can see how if I'm doing an overhead press or something like that, how that's keeping my back nice and safe, as opposed to this, if I were to do that, then I could actually really hurt my back. So anytime that you're doing ab exercises, your back should never arch. If you feel that your lower back is pulling away from the ground, you know that your abs aren't engaged anymore and you need to stop because there's no point in doing it. So it's really important to know the difference between your core and your abs. So next time when you do your ab exercises, really, really, really focus on hitting that Kegel and hitting that TVA, and I bet you anything you'll see results in no time.